major redetermination process. There, we know that there's massive disenrollments of people who were eligible. According to the Public Records Act information, about 91% of children who were disenrolled not based on the fact that they weren't eligible, but based on administrative, bureaucratic reasons. And so how do we make sure that families get the information they need to keep their coverage if they're eligible and continue to get the medicine and the healthcare that they need to thrive? And the answer to that is you all. So hopefully we can spend some time today doing what the folks at Tennessee Justice Center have always done, which is take really complicated stuff, make it simple, and ensure that we're viewing the world from the perspective of families and kids so they can get the help they need to thrive. And I'm going to hand it over to Rob, and thanks for being here, y'all.
Thank you, Michelle. And again, thanks to everybody joining on today's webinar. So this is TennCare Redetermination, a call to collaborate. We're going to explain quite a few things about redetermination, TennCare's plan, but it's also a call to collaborate. So there's ways that you can plug in, partner with us, volunteer, get access to information that will be helpful, hopefully to you, your constituents, the people that you serve. And so there's going to be opportunities throughout this to do that. There's also been information that's been shared, a contact form on an email that went out yesterday regarding today's presentation. There will also be a link in today's presentation where you can access that form as well. So we encourage you to do that so that we can all work together and really get people the help that they need, and so they get to keep their coverage. So for today's webinar, presenters will be myself, Gordon Bonneman, and Sheena Watkins. I'm Rob, I'm the COO at the TJC, and I will be your host for today's webinar. Gordon is a staff attorney and co-founder, former executive director of the TJC, has a wealth of knowledge about redetermination, historical perspective, and really what's going on currently with this process. And then Sheena is our outreach coordinator for all things redetermination. If you'd like to explore ways to partner with the TJC, even get the latest updates or volunteer, anything having to do with redetermination, the renewal process, please reach out to Sheena and we'll get back to you and figure out ways that we can partner. So a little bit about today's agenda. We're going to give an overview of redetermination. We're going to talk about TennCare's plan, also give you our insights of what we think will happen, what the challenges are and the potential pitfalls to avoid. And then we're going to talk about how we can all help one another and help the constituents, current enrollees, keep their coverage. And of course, we're going to have a question and answer session at the end. Like I said, please feel free to enter your questions at any time, and then we'll answer as many as we can towards the end. So when we talk about redetermination, it's officially called the renewal process for TennCare, but it's also been known as recertification and re-verification. And the purpose is to determine if an enrollee is actually still eligible for coverage. It's normally a yearly process to check eligibility. But in March of 2020, TennCare agreed not to terminate people from Medicaid in exchange for a higher reimbursement rate from the federal government for Medicaid during the declaration of the federal public health emergency. So in other words, TennCare got financially incentivized not to terminate people from the program. Congress ended this moratorium on terminations in December of last year and decoupled it from the public health emergency declaration. The resumption of redetermination in Tennessee and other states presents the single largest health coverage transition event since the enactment of the Affordable Care Act. So it's really a big undertaking. The thing to keep in mind is, unlike open enrollment under the ACA, this is a marathon and not necessarily a sprint. And that's because in Tennessee, this process will take place over the course of approximately 12 months. So it's really a big deal. For starters, it's a big undertaking. There are 1.75 million people on TennCare and Cover Kids now. We know that the state has had a really big problem in the past with redetermination. Before the pandemic, nearly 200,000 enrollees lost their coverage during this process. The uncompensated care risk is also big for providers, especially for hospitals that serve low-income populations or are located in rural parts of the state. But the stakes are the biggest for our neighbors who rely on TennCare and Cover Kids for their health insurance. The bottom line, this is a really big deal. Hang on a second, we've got a problem with the slides. Give me just a moment. Okay, folks, sorry about that. We hopefully have this squared away. To pick up where I've left off here a little bit. In March of 2020, in response to the pandemic, Congress incentivized states not to terminate anyone from their Medicaid programs during the public health emergency. This resulted in approximately 100,000 new people being added to the program each year, as you can see from the chart. The law normally requires states to redetermine eligibility for all enrollees every year, but that was paused during the public health emergency. With minor exceptions, no one was cut off from the program after March of 2020. With 300,000 new people coming on over 3 years and almost no terminations, as you can imagine, the TennCare enrollment grew from about 1.4 million to 1.7 million people, over half of whom are children. As I mentioned, Congress ended the moratorium on disenrollments, and the renewal process will start later this month. TennCare anticipates it will get back to its pre-pandemic enrollment over the next 2 years. That means a net reduction of over 300,000. Over that period, 200,000 new enrollees are expected to come onto TennCare, and to offset those new enrollees and to reduce the net enrollment by 300,000, that will mean that nearly 500,000 people will lose their coverage over the next 2 years. To make matters worse, it's a complex process that is prone to mistakes. As you can imagine, it'll be hard for people with disabilities or limited English proficiency. Misdelivery of notices, processing, and human errors make navigating the entire process hard. Paperwork is the #1 reason for the loss of coverage. But keep in mind that nearly all children should remain covered or should remain eligible for coverage. And adults are likely eligible for an ACA plan if they're not eligible during the new redetermination process for Medicaid. The state has done a lot of things to improve the process, but even if it runs as designed, the need for one-on-one help is absolutely enormous. Hundreds of thousands of Tennesseans will need help to retain their coverage or transition to other coverage. So here's how redetermination is supposed to work. just about every category of TennCare is subject to redetermination. So that's going to include the MAGI categories. That's the lion's share of the people that are on Medicaid. So that's going to be children, pregnant women, adult caretaker relatives, people on covered kids, which is Tennessee's CHIP program, people on medically needy spend down. That's going to be pregnant women and children under the age of 21. The aged, blind, and disabled categories, those are all going to be subject to redetermination or potential for that. The exception will be people that are on TennCare because they're enrolled in SSI. And SSI is supplemental security income. It is different from Social Security income or benefits that they may receive, right? So people that receive SSI receive a cash benefit. Once they receive that cash benefit, it's also an automatic ticket to TennCare, and it should be enrolled into the program, right? So because it happens that way, and the Social Security Administration is making that determination regarding SSI eligibility, naturally it makes sense for them to make the determination of whether they get to keep it or not. So that's the one exception that won't be subject to redetermination are those enrollees receiving SSI. So first, let's talk about ex parte review. So first, the state must perform a review. The purpose is to determine eligibility without actually asking enrollees for additional information. So under federal law, states are required to use information they already have in their possession to make this determination of, or renewal, if you would. The review is automatically processed and completed using information available to TennCare, including information from electronic data sources. For some folks, this can include SNAP or food stamp and TANF financial data. So they must review eligibility for all open categories of Medicaid, not just the category that the enrollee is currently enrolled. And TennCare officials have said that they hope to renew coverage of half of the enrollees through the ex parte review. If determined eligible, during this review, the enrollee does not receive a redetermination packet. When the state cannot make a determination based on ex parte review, then renewal packet is sent. And as an advocate, knowing these deadlines is really very important. So the first is 40 days. There are 40 days to return the completed renewal packet, inclusive of mail time from the date the packet is sent to the enrollee. It can be done by phone, in person, by mail, or by fax. So in other words, when TennCare generates the renewal packet, and once that is generated and it is dated, it's going to be 40 days from that date for the individual to get the information back to TennCare. The next important deadline is the 20-day deadline. Verification request will provide the enrollee with 20 days, inclusive of mail time, to submit requested information. Verification requests are just a request for proof, generally, information from the enrollee that has to be given to TennCare to prove the information that they're providing in the packet. Most commonly, that's going to be income. So, for example, if someone says, I lost my job and now I have a new one, so I'm making less money, TennCare might go out to the data hub and find actually old income information from that. And so when the enrollee returns the packet, that income doesn't match what TennCare is pulling from the data hub. And when that inconsistency happens, then they'll do a verification request, and they'll send a request that says, please provide proof of your income. And so they could send payment stubs and things like that. That's just one example of a verification request. But when those requests are made, the individual or the enrollees are going to have 20 days to provide that information. It includes the time that it takes, the date from the verification request will be 20 days from that. So it's really kind of a short period of time in order to get that information back in, okay? 20 days also applies to any adverse determination made by TennCare, like terminating someone from the program, right? And so they must provide 20 days advance notice of that termination date, okay? And so any enrollees who fail to return the packet within the 40-day period or fail to respond to a verification request or request an appeal within that 20-day period, then they're going to be terminated. That brings us to the all-important second chance or the 90-day deadline, another important timeline to keep in the back of your mind. Individuals may submit a renewal packet or additional information requested up to 90 days after termination of eligibility for failing to comply, right? So this 90-day second chance only applies to people that didn't return the packet or didn't respond to a verification request. The second chance does not apply to people that submitted all the information back in, TennCare reviewed that information, and based on that determined they were no longer eligible. So it doesn't apply to them. It's only to people that didn't respond to the initial packet or a verification request. So as I mentioned, enrollees have 90 days after being terminated to provide missing information or proof. It covers the verification requests that are not responded to in a timely manner. So it's really important to know. No gap in coverage. So this can be a way to eliminate medical debt. So if you submit this information in during the second chance period or the reconsideration period, and TennCare then determines, yes, they are eligible, it will backdate and eliminate those gaps in coverage. So that's important to keep in mind, especially people that might have incurred medical debt during that gap. May also simplify the process for reinstating prior approvals for treatment. So this is also important. If you've had, someone had TennCare, they had prior approval for certain medical treatments, reinstating that might be easier than actually going ahead and replying and having to reapply. So that's another reason that someone's going to want to take advantage of the reconsideration period. So as for all these reasons I've given you, so eliminating potential of medical debt, reinstating prior approvals, we always prefer to utilize this reconsideration period as opposed to starting over with a brand new application. This slide has been lifted from a presentation at CMS, a federal agency that oversees Medicaid and CHIP, sent to the states last week. A couple of important things to note. The state cannot rely on children to translate for their adult caretakers other than in emergencies. So in other words, it can't say, well, you're going to get language help because you're going to rely on your child to help you with that. That's not allowed. States must adapt its process to reasonably accommodate the needs of individuals with disabilities. And as you can imagine, that's going to run the gambit from people with cognitive impairments to people who are deaf, visually impaired, or have physical disabilities, right? So they must adapt the process to help these people. And then in-person assistance must also be available to those who need it. So these are some of the things that you need to be aware of that are out there, that people that might have difficulty with this process, that should be able to get some help with it. The other thing that I want to point out, and we'll be going into more detail about this later in another webinar we will do that will get really into the weeds of the redetermination process. But there are 3 different category options of eligibility for enrollees that are in danger really of losing their coverage through the redetermination process, all right? And they're created really for people that are just really misqualifying for coverage. And I'll just briefly touch on these. The first is TennCare Standard. It's really for children under the age of 19. It is a MAGI category. And it's only available to children who are on TennCare and are losing coverage. An important thing here is they cannot have health insurance or access to health insurance. And access doesn't mean going out and purchasing a plan on the marketplace, okay? Now, there's a couple of things that you should know about TennCare Standard. It really bumps up the income level for a lot of children, and it's below 216% of the federal poverty level. That includes the 5% disregard that's available. And so that's an important thing to know when you're dealing with it. But for children that have income in excess of that 216% of the federal poverty level, if they have a qualifying medical condition, then there is no income requirement for that. Keep in mind, qualifying for that medical condition can be quite tricky. It will require a medical review. A lot of these kids, if they have that or they're on they might be on TennCare standard because of having one of these medical conditions and their income is over the limit. Hopefully they'll be able to keep it still on TennCare standard. But keep in mind that this is something that's available for children that are getting ready to lose their coverage. The other two are transitional Medicaid and extended Medicaid. So transitional Medicaid are for enrollees losing coverage in the caretaker relative or TennCare for children categories due to an increase in earned income. Okay, so that's what's really kind of doing that. A couple of the non-financial requirements that you have to, they have to be enrolled in TennCare and losing coverage. And they had to have been eligible for TennCare for 3 of the previous 6 months immediately preceding ineligibility. So they had to be right kind of on the bubble, transitioning on and off of being eligible. If they are eligible, they're going to be able to keep their coverage for about 12 months. Extended Medicaid works the same way. The only exception here is it's for enrollees losing coverage in the caretaker relative or TennCare for children categories due to an increase in spousal support. All right. So if it's spousal support increases and that causes someone to lose coverage, then once again, they have to be so close that they would have been eligible 3 out of the 6 previous months of coverage. And once again, just like transitional Medicaid, if they are found eligible, that they're going to be able to keep it for about 12 months. So we'll go into this in much greater detail. I think the important takeaway here is there is additional coverage categories available for people that might lose it. So if you're not familiar with them, you might want to check in and attend our next webinar. We'll be going over this in a little more detail. That brings us to TennCare's redetermination plan. And with this, I will be turning it over to my colleague, Gordon Bonneman, to discuss this with you. Again, I apologize for the technical difficulties that we were having at the beginning. We're a bunch of lawyers at the TJC and not necessarily tech experts. So with this, take it away, Gordon.
Hey, speak for yourself, Rob. You can tell from looking at my grizzled face that I'm all over the tech stuff. So thank you folks for joining us, and I'm proud to be here. Just want to let you know a lot of planning has gone into this transition, planning at the federal level by the federal agency CMS, which has been preparing for this for some time. And state officials here in Tennessee have put a lot into getting ready for this. They submitted a plan to CMS recently in which they showed, explained what they were, what their priorities were, and they are going to begin the process by sending out the first packets later this month and towards the 3rd or 4th week of March. And they're not, as Rob was saying earlier, this is a marathon, it's not a sprint. So the people who have not been renewed through the ex parte process and who will have to provide more information are divided into monthly batches. And you can see from this chart, which comes from TennCare's plan, that the first cohort is 54,442 people. And it builds up until 6 months out, it peaks at about 11%. And over the next year, the plan is that everyone will have received the packets who have not already been approved for ex parte. That graph that we showed you earlier that showed the increase over the course of the past 3 years, and then what TennCare anticipates will be the decline in net enrollment, that actually is stretches out to 2 years because there will be a significant tail on this process after the packets have gone out for people who avail themselves of the 90-day reconsideration period if they were terminated for failure to submit information. And it also will include, we expect, a lot of appeals. So the state is anticipating that although the packets will go out over the next 12 months, the actual process of terminating coverage will extend over the next 2 years. The goal, as Rob was saying, or at least what's anticipated by state officials, is that the total disenrollments will approach 500,000. And that's in order to reach a net decrease of 300,000 enrollment, offsetting the 200,000 people that we can expect to come onto the rolls over the next 2 years. What's important to understand is that TennCare is front loading in these first 2 months. The members most likely to be cut off. These are people who have not been in touch with the program over the past 3 years and who were identified as potentially having problems with their records when before the pandemic, TennCare transitioned from an old IT system to the new TennCare eligibility determination system known by the acronym TEDS. There are about 85,000 people in that process. They are going to be put through the process first. And we're very concerned that because of processing errors that occurred 3 or 4 years ago, some of those people may not be connected, their information not be connected to the other people in their households. They may not get the notices because the addresses are defective. There's a lot of reasons for concern about. So the first 2 months are going to be particularly important. And we think a lot of those people will only learn that they've lost coverage when they, for example, try to go fill a prescription or make an appointment at a doctor's office, only to be told that they've lost their coverage. TennCare enrollees can expect that many of them will not get the packets because, again, hopefully they may be in the group that's allowed to be approved through the ex parte process based on information the state already exceeds. The maximum number in any given month will not exceed 1/9 of the total TennCare population, or 11%. Providers can check to see the renewal dates through TennCare's online lookup system, and TennCare enrollees can check for their renewal dates by opening a TennCare Connect online account. And we will, this slide presentation includes links to useful videos on TennCare's site telling people how to do that. And we're going to cover that extensively in a future webinar, because the TennCare Connect portal is an important resource for enrollees and a very positive element of the TEDS system. One thing that the state is doing is expanding the ex parte review. They are going to approve members if they have open SNAP or food stamp accounts or TANF coverage, known in Tennessee as Families First. TennCare categories where resources have previously been verified will be approved using the automated resource verification system, and enrollees previously verified with 0 income. That's provided that they don't have newer contradictory data, in which case they will go through the enrollment process. But this is an effort by the state to streamline the process and approve as many people as they can based on available data. The renewal packet this time will be sent to households, not individuals. Previously, there have been situations where multiple people in the same household would each get extensive written packets that they had to fill out, and it was for significantly sized households that could be quite challenging. Now they're going to send a single packet for households, which will encompass all of the individuals in the households. That's the good news. The bad news is, as I was mentioning earlier, There were problems several years ago before the pandemic when they converted to the new TED system of people not being connected to the households. And there are about 85,000 people we're concerned may be in that uncertain status. TennCare is going to mail pre-renewal notices to people to say, look out, expect for these packets to come. They hope if those come back from bad addresses that they'll get address corrections. The renewal forms will be pre-populated with information that the state already has, so they won't have to fill out information that they've already submitted or the state has available. There will be a 10% reasonable compatibility threshold. So in other words, if the information that the state receives from the enrollees is within 10% of information that's compatible with other electronic data that the state can access from its own records from the federal data hub, that will be good enough to re-enroll the person or renew their coverage. And they will use a data hierarchy to guide the verification process. And what that means is they will try to, the software will try to find the person eligible in a cascade of different categories, starting with those that have the most generous benefits, so that if people are found eligible in that category, they will stop and not keep looking at the other categories. They'll only look at the lower categories of coverage if they don't qualify in the higher benefit levels. Enrollees can provide the information requested via phone, fax, and we urge people to keep the receipt. Mail, we recommend certified mail, return receipt requested, and TennCare does the same. They make the same recommendation because there have been issues which they acknowledge in the past of mail not getting connected to the file. And so people end up being terminated for not submitting information when in fact they have. So it's important to keep that true. They can do it in person over the TennCare Connect call center line, which will be prominently displayed in the notices. And they can also do it online via the TennCare Connect account portal. And again, we will send you the link to that, but we'll also cover how to do that going forward, in addition to videos that have that information. Decisions and appeals. If individuals are determined ineligible by law, they are to be transitioned to the information is supposed to be sent to the federal insurance marketplace so that it can be taken into account. They can have access to insurance on the marketplace, and depending upon their income, they may be able to get coverage that provides essential health benefits at no cost. And there's a sliding scale depending upon their income. And the notices that they get from TennCare to include detailed contact information for how to follow up. So again, as Rob was saying earlier, it's important to realize that not only do we want to make sure that people who are eligible for TennCare retain their coverage and are accurately and reliably re-enrolled, but if they're not eligible, that this transition to the marketplace to other options also occurs. They will be offered a chance to appeal, and we urge those who are appealing this situation or assisting others to always appeal and request continuation of benefits for enrollees so that the coverage will continue while the appeal is in place. And the reason why we urge that is because the process is complex. We know that it is error prone. And so you want to file a timely appeal. You have a limited period of time to do that. Go ahead and do that. And then if it turns out that the person is ineligible, they can withdraw the appeal. Just want to make a few points again. As I indicated earlier, TennCare will use information to streamline the process, and they will, for example, renew people with income information that showed zero income, but all of that is subject to the proviso that there can't be contradicting data. And sometimes the different data sources don't agree. We're very concerned about the opportunity for mail to go awry. Keep in mind that it's been 3 years since the last renewals. In some cases, depending upon where they were in the monthly cycle, it could have been nearly 4 years. There was no reason for individuals to keep TennCare informed. I mean, hopefully they did, but they weren't getting prompts during that time. And we know that there was a lot of mobility, a lot of displacements during the pandemic among low-income people that lost their housing or had to move. So there's a lot of concern about that. And the state has tried to update information using a number of postal address resources, but still that's a big concern. Just want to remind folks of a couple of key points, which is to request continuation of benefits when filing an appeal and use the 90-day period to submit missing information. If someone is terminated after they've sent in all of the information and a determination is made that they just aren't eligible, the answer there is to appeal. If they are terminated, not because they were found ineligible, but because TennCare believes they did not send in the information that was needed, they should appeal, but they should also use the 90-day period to submit the missing information. TennCare has informed CMS that it will continue to monitor the situation going forward, and if there's early warning triggers of large numbers losing their coverage due to no response or missing paperwork, they make changes. There's a circuit breaker supposedly to pause and consider a change in practices to stop erroneous coverage loss. And then TennCare has requested proposals for bid to contract to provide additional assistance to enrollees. We're very pleased with all of these things. The bids are due for this new contract this week. So we will know soon what that consists of. We're grateful to TennCare for making those efforts. But again, when you look at the complexity and the challenges, this really is a case where we need all hands on deck. In the meantime, we suggest that people make sure that their TennCare has their enrollees' contact information, and the easiest and fastest way to use is to use the TennCare Connect portal and update information, establish a timeline of events. So set out what the deadlines are for individuals to meet the deadlines that are going to be imposed for their submitting information and meeting any requests for additional materials that they may receive, and to understand when it is that they need to appeal and request continued coverage if they are terminated. And again, finally, I can't repeat too often, if they're terminated for failure to submit information, to consider using the 90-day second chance opportunities to submit that information. It really is superior to starting over. Here are some links to TennCare videos on their website. And again, we will post this slide deck by Friday midday and also make this video available so you can access it there. But you can also just Google TennCare renewals and you will see useful information there. So at this point, I'm going to introduce my colleague, Shana Watkins. Shana, take it away.
Thank you all. First thing I want to say is thank you to everyone who's attending today, because as you're doing that, you are supporting folks who are on TennCare, but you're also showing a commitment to each other, not just to TJC, but to become part of this net of partnerships so that we can prevent folks from losing their health care, which is what we're all interested in doing. I am the outreach coordinator at Tennessee Justice Center. So I'm very, very interested in partnerships, ideas that you have for getting the word out to people so that they understand this whole otherwise very confusing transitional period. Before I forget, I want to point out what's on the slide here, and that is some upcoming trainings that will be happening that TJC is sponsoring. This just goes a little bit more into the weeds of the policy. The first one is March 8th, and that's going to be an advanced training. This is specifically for advocates, and you can register here. And then March 22nd will be how to spot issues and access help. And again, you can register there. Other things I want to say, there are a couple of different ways, 3 to be exact, to make referrals to TJC. If you have any families or clients who have questions about the policy, if they're eligible, if they're not eligible, or if they just need an expert hand to hold through the whole renewal process or just enrolling, they can email our casework supervisor, who's Diana Gallagher, and her address is here, her email address. They can call this 877 number that you see on your screen, or they can complete the TJC online form. This is basically an online referral. And what you'll see when you go to that form is a 7-question, very brief form. And it's just basically, what's your name, what's a good number to reach you at, and what time of day is a good time of day for us to reach you, which we'll honor, because we realize people are working various times of day, and some days they have off during the week or not. So we'll work with them and try to be flexible as far as that goes. You also see my email address here. There's just absolutely no limit to what partnership opportunities I will entertain. So if you have an idea, I definitely want to hear it. Even if it's not something that TJC can help you with, I really would hope and delight in putting you in contact with someone else I know who might be a better fit. But no idea is a bad idea, because I'm sure it's born out of really, really good intentions. So nothing's off the table. I'm going to go back to my metaphor about being a net. We're all strands of that net. We're all just trying to catch anyone and help everyone to not fall through the cracks. And if we just partner up and make sure that we stay in contact with each other and come up with creative ways to help people, we will. There's also a form that you can fill out where you can stay informed about things concerning this issue. And I also want to remind you of something Rob said early, which is that you should have received an email yesterday that had all of these links and links to some of my materials that are both in English and Spanish. And then there's also a form that I sent that's in that email. There's a link to that's just kind of a general what the Tennessee Justice Center does. We'd love it if you could take a few minutes to fill out this form, and that way we can keep in touch with you and make sure that you are abreast of any news. And I'm going to stick around for questions too, if anybody has any questions about partnering. Thank you.
Thanks, Shana. So as we indicated, we are going to do a question and answer session. We've got quite a few questions that have been loaded up in the Q&A. And so we'll start kind of going through those. We slated this webinar to last approximately 1 hour. However, we're going to stick around and answer as many questions as we can. We hope that you're able to stay tuned in with us, but if you're not able to, that's okay. Once again, this will be recorded. We will post it on our on-demand portal. So let's go ahead and kind of get started here on our Q&As. So one question that pops up is, how will this affect the ECF Choices members who are historically or could make more money than the regular applicants and didn't have?
Thank you for the question. They will go through the renewal process. We know historically TennCare has been very concerned about their vulnerability. And for those who don't know, ECF Choices is a special program that provides home and community-based services for individuals with intellectual or developmental disabilities. And so we hope will be dealt with in a special way. We don't know the details of that yet, but for both ECF Choices and the regular Choices program, which is individuals who are either in nursing homes or receiving home and community-based services, our understanding is that there will be a special process for them, but we don't know what that is yet.
Okay. And that also includes stuff about income and all things that access the renewal process when it comes to ECF.
Right.
Okay. So next question is, are caregivers for adult and children with mental disability eligible to continue in TennCare? What is the income guideline for this category?
So the eligibility rules are not changing. What is changing right now is that we've had this 3-year pause in the annual renewal process. And with that comes this crunch of cranking that back up and pushing a lot of people through who haven't had contact. And therefore, there's a lot of concern about addresses not being current and just the strain on the entire system. But the eligibility rules have not changed. And so therefore, the income guidelines haven't changed either. The question was, are caregivers for adult or child with mental disability eligible to continue in TennCare? And the answer to that is that in the MAGI category, that when children age out, either turn 18 or if they're in school until they turn 19 or leave school, their caregivers will no longer be eligible in that category, but they may become eligible in their own right. The caregivers may in another category. The mother could become pregnant, for example, or there could be disability or breast or cervical cancer. There are a number of different categories, and those all have different income guidelines. But again, I want to emphasize those rules haven't changed. What has changed is just the resumption of renewals.
And so just another thing to kind of point out here is that this is a review of all open categories of Medicaid. So if, for example, we had someone eligible as a caretaker relative, they're not just going to screen them for eligibility for the caretaker relative category, but rather all open categories of Medicaid. So that's an important thing to know. The last point I will make about caretaker relative, that is probably the one category of Medicaid that is kind of set by rule, or I believe it's actually in the state plan. It's not tied to the federal poverty level or percentage of it. And so what ends up happening as the FPLs increase each year, the actual percentage of that goes down because the state doesn't really change by rule those income limits based on the family size.
Although there is a proposal on the table to try to bump that up to the federal poverty level, which we're grateful.
Yeah, we're hoping that happens, but as of right now, as you look at it, until we hear differently, it's going to be set out probably in the policy manual for those actual income limits. So the next question is, how will this apply to ECF Choices program since working with members having different income guidelines, didn't have to report income? Looks like through Blue Cross Blue Shield of Tennessee. This is a person who does not draw SSI or Social Security disability. So we've kind of answered this a little bit before. We're not really quite sure of what this is going to look like exactly, but it's something to keep abreast of. And if you encounter anything that your constituents or the people that you're helping receives, please share it with us. We'd love to take a look at it and see how they're really using it and how this process is working for this population. If someone who just recently renewed coverage in January, will they go through the redetermination?
And the answer to that is no. They should have been renewed for 12 months.
Right. So redetermination occurs once every 12 months, not sooner than that, unless they report, for example, an income change or some other voluntary report to TennCare that would draw into question whether or not they're still eligible.
Yeah, thank you, Rob, for raising that, because the annual renewal is an automatic requirement for everyone except those receiving SSI, as Rob explained earlier. But it's important to realize that if TennCare gets information that suggests that someone may not be eligible in the meantime, then they can ask them to submit information to show that they're that they have not become ineligible.
Another question. This person is a CAC for Connect to Health in Nashville. Are we qualified to assist with re-enrollment with Medicaid?
And the answer to that is anyone can help with re-enrollment with Medicaid. And in fact, the inspiration for this webinar and our call to folks to collaborate is that you don't have to be a certified application counselor, although we're grateful to have those with that certification helping. But this is a situation where any number of people can and do help. So absolutely, yes, your help would be welcome.
Is there a graph of the growth that breaks out children from adults?
You can Google TennCare enrollment, and it will take you to if you sort through the clutter of ads on Google, it will take you to a state TennCare website that has the monthly enrollment broken down by age groups, and those data are updated about 6 weeks after the close of the month. And you can track, so you can use that to track the growth.
Are individuals receiving QMB or SlimB, those are the Medicare savings programs, subject to redetermination?
And the answer is yes.
Yes, they will be. So QMB, SlimB, those are Medicare savings programs. Qualified QMB stands for Qualified Medicare Beneficiary and Special Low Income Medicare Beneficiary. So those are the ones that obviously are probably the most common, will be subject to redetermination, but really any of the Medicare savings programs will be. Next question is, will Medicare Extra Help clients be redetermined?
Our understanding is the answer to that is yes, but we don't know the process. This is an assumption and only an assumption, so take it for what it's worth. But I suspect that they would be perhaps done later simply because the state seems to be prioritizing those who are eligible for full coverage that they think they may be able to remove from the rolls more quickly.
So this question has to do with the 20-day time frame for submitting verifications. Is this time after the 40-day time frame to submit a new application? Well, in this instance, what typically happens is they're going to get that initial packet of information, and it's when they return that packet of information back to TennCare, that's typically what's going to generate a verification request. They're going to review that information, compare it with what they have, and if there is a deviation from that, more than 10%, for example, with income, then they're going to make that verification request. And that's what's going to trigger that 20-day timeline. You know, one of the best practices that we suggest is if you're helping people, that you also help them establish a TennCare Connect account, and that you help them monitor it. Because within really about 24 hours of a verification request or a notice being generated in TennCare Connect, it should be posted on the portal. And so if you think about it, that verification request is also going to be mailed, right? But it's going to be mailed depending on the date that it's mailed, where it's being mailed to, what kind of problems the Postal Service is having. You can imagine it might take a week before it actually gets to its final destination and the person gets it, and now they got even a shorter period of time. So the best practice would be to monitor that, because within 24 hours, that verification request should hit the portal. Even though you don't have it in the mail, you can actually download, you can read it, you can actually even submit a response to that or your proof using the upload feature in TennCare Connect. So that's the best practice that we would suggest that you get in the habit of doing.
If I can just put in another plug for opening TennCare account portals, one of the things that concerns us, and I think concerns federal and state employees, officials, is that when this hits, there's going to be overwhelming demand on the call center, and we're worried about wait times and dropped calls based on historical experience. And so If you are comfortable helping people open TennCare Connect accounts and use that communication resource, that can help short circuit some of that, work around some of what we think could be significant call center issues.
The next
And
question
could
is how will clients, oh, go ahead.
I just have one comment about TennCare Connect and its importance, especially with families who are experiencing homelessness. A lot of school personnel, social workers, and anyone working under McKinney-Vento is especially concerned about that. So I don't know if you all can speak to that, but I just kind of wanted to bring that up as a good, probably a necessary method for communicating with those folks who don't really have a permanent address.
Thank you so much, Shana. That's a really important point. And again, just to under the realm of shameless self-promotion, this is just a plug to join our future webinars where we can go into this in more detail.
So next question is, how will clients know they receive a verification request? Will that notification be through TennCare Connect or mailed? Well, first of all, when you establish a TennCare Connect account, you do have the option to indicate how you would like to be notified in the future with that. But if they don't have a TennCare Connect account, it should be mailed. Or if they haven't answered that, haven't put in their preferred method of being contacted, it should be mailed. Again, we would recommend that you, regardless, that you just go ahead and establish a TennCare Connect account and help them monitor that account, because those verification requests will be uploaded within 24 hours of them being mailed. And just keep in mind, as I mentioned about the verification request, that 20-day timer starts really when the when it is dated and mailed. It's not going to be when actually that the person receives it. So next question is, when does the 90-day clock start? From the date they reach out or from the date we requested the information? So the reconsideration 90-day clock is going to start once they get terminated. So it's 90 days from the time when they get terminated. And as you recall from what I mentioned previously, TennCare is going to give them 20 days advance notice of any termination. Then once that termination kicks in, that date is when the 90 days starts. So if you really kind of think of it holistically here, they're going to have 40 days to return the packet. If they don't receive the packet, maybe they moved, maybe for whatever reason it never gets delivered, then there's going to be 20 days. They're going to get a notice from TennCare at the end of 40. At 20 days from that notice, they're going to be terminated. Once again, let's say they don't get the mail, that 20 days passes, and then another 90 days is going to kick in from that point in time. Right. So as you can imagine, it's going to be several months potentially for people that don't respond before actually they've exhausted their second chance opportunity. Again, people that you're helping, especially providers that might be on this call, any outreach you can do to people that are already on TennCare that are on TennCare, reminding them to update their information, to create a TennCare Connect portal will only help you in the future. Because if they have moved and they didn't notify TennCare, these packets are not going to get delivered to them. They're over the course of time, they're going to get terminated, and they're not going to know it until they come to your practice, your hospital, and then they're going to wash up across your threshold, for example, and they're not going to be covered. And so there's ways that you can get ahead of that and really head the problems off and save yourself a lot of grief on the front end, if you can do that. And we have an offer to help people with that. What does the messaging need to look like? Who can actually help with that? Because as Shana pointed out, we can actually help people if they don't know how to navigate it. So once again, this is one of the things that we can help you. If you'd like to think of a way that you can reach out to your existing TennCare population that you serve, we can help you with those notices and actually even help you with some of those enrollments if need be. Next question is, are there a list of resources where individuals can go to get help with renewal packets in their local area? So I don't know, Shana, if you want to comment on any of this. Once again, I think it's going to vary throughout the state and where people are located as far as getting help. Once again, they can always call us and get assistance.
Yeah, I'm actually working on that for someone in Hamlin County right now. We're going to Hamlin County to do an enrollment clinic or a renewal clinic to help people who want to come to the Family Resource Center there. So we can discuss doing that elsewhere. But they asked me for other resources for when we're, after our enrollment event. So I'm working on that, but let's see, that was an anonymous attendee, but if you want to email me, I can work on that for you in your area as well. I'd love to.
Let me just add that the state is telling folks that they can go to the county office of the Department of Human Services. Old hands on this call will recall that a decade ago and before that, county DHS offices actually were the enrollment portal for Medicaid or TennCare. That stopped in 2014, but they have kiosks where people can use. It's unclear just how much hands-on help will be available there, but at least there will be computer kiosks.
And we're also working on developing, it's in construction in progress right now, our webpage regarding redeterminations, where we will have kind of links to potential help in your area. Once again, we can help as well. Most of the stuff can be done by telephone. Obviously, renewals and stuff can be done online. So those are important things that we can help out along those lines. And as Shana mentioned, we are doing some enrollment events kind of throughout the state. It's really kind of a question of really working and collaborating with people in those local areas to see who we can help. But that's a good question. Another one is, does TennCare Standard have a premium or a copay? Well, TennCare Standard is a form of Medicaid, and so in this particular instance, there really shouldn't be a premium or a copay associated.
Premiums were collected years ago, and the state had so much difficulty with it that I think they discontinued it. I'm not sure about copays. There are not copays for children's services, and TennCare Standard does cover children, but I'm just frankly not sure about that. If that becomes an issue for you, then please let us know. We'll get an answer for you.
So next question, does this mean that many of the obstetric patients could be losing their TennCare in the middle, I assume, of their care, or the treatment plan that they're receiving?
I think the answer to that is yes, they are at risk, but probably it depends on where they are in the cycle. For example, if they only became eligible when they became pregnant and that they signed up based on their pregnancy, then they're probably not in the renewal process, which is because they will have been signed up too recently. On the other hand, if they already have children, they're eligible as TennCare relative, and pregnancy is not the basis for their eligibility. Their number could come up, their household could get a renewal packet, and if that goes to the wrong place or they fail to complete it or a glitch happens at TennCare, yes, that could happen. So again, we want everybody to be aware that this is happening and to just be alert to where folks could fall through the cracks. And always we want to know about those situations so that we can better help and share the information within this network of helpers.
And keep in mind, there's postpartum coverage that's available that's been expanded from 60 days to 12 months. You can also use the continuation of benefits that we talked about earlier. So if they receive something that looks like they're going to lose their coverage, you get a notice that they're going to be terminated. You can always file an appeal and request continuation of benefits. Our understanding is once you file an appeal, that should be enough to get it, but we think the best practice is still to request continuation of benefits. And that gives us an opportunity. They'll actually be able to keep their coverage until a decision is ultimately made on their eligibility. So as you can imagine, there's liable to be, problems within the screening process, the algorithm that's being used that could cause people to be terminated that shouldn't be. And a lot of times the appeal process is just really a way of getting it to a live person to review. And if you need help with those appeals, those are things that we can help you with. We find that most of the time when you file an appeal, if you provide the necessary documentation and information that establishes their eligibility, that they will get approved without the need of going to a hearing. So appeals sound scary, they don't need to be, but we're willing to help you navigate that process as well. It says, will patients be mailed a notice of their TennCare insurance status? That seems to be a little bit broad. I mean, obviously you're going to get a card in the mail,
If
right?
you get, yes, you will get a notice if you go through this process that we're describing, where you're sent a packet and you send it back. You'll get a decision saying that you're eligible, or who in the household is eligible. It may be different for different people in the households, which can be confusing sometimes, because you may open a packet if there are 4 people in the household and you'll see a notice that one person is eligible and another is not. And that's a function of the complexity of Medicaid eligibility and the fact that different demographic status, whether you're a parent or a child or someone with disabilities, those are all subject to different eligibility requirements. But you will, if you go through this process, you will get a decision, and it will tell you about your appeal rights if in fact you are found to be ineligible.
So the next question is, are the scheduled monthly periods divided up by original approval date? I am wondering if certain programs will be grouped for redetermination.
What we understand is that TennCare, think of that what happened 3 years ago as musical chairs. Somebody paused the music and it's been frozen there for 3 years. So if you would have come up for renewal in April of 2020, your group is going to come up for renewal in April 2023 is the way it's been described. So they are not going back in and moving those people around very much, except that, as I indicated earlier, they've told CMS that TennCare intends to prioritize the people in a group of about 85,000 whose eligibility status was put in limbo during the conversion from the old IT systems. And as we mentioned earlier, if someone wants to know when they're coming up, they can open a TennCare Connect account, and that information should be in there.
But as you mentioned previously, they're going to go after the people in the initial months that they've had the least amount of contact with.
Right. So I used a poor, thanks, Rob. I used a poor example by saying April, because April is going to be that group. But they've said that once they get past that, the first couple of months and work through this 85,000 cohort, they are going to, generally speaking, they've said, follow whatever the cycle was before the pause occurred.
It says, and next question is for young adults at 20 years old who are mentally disabled and facing being kicked off their parents' TennCare by 21, will they be automatically enrolled, or do they have to have a representative to complete the redetermination letter?
Anyone can help someone else complete the redetermination letter. You don't have to be the conservator. You don't have to have guardianship. You don't have to be a certified application counselor. Anyone can help. And that's one of the points we want to make. So the more people get trained on how to do this, the more we'll be able to help individuals like the person who's the subject of this question.
So next question is, in case this isn't covered later in the presentation, and I might forget to ask, will individuals be notified if their coverage will continue based on that first automated determination based on existing information? I'm assuming what we're talking about here is the ex parte review. So they don't have to be on the lookout for a renewal packet that will never come.
And we don't know what the ex parte review is just taking place this month, and we don't know whether that will generate notices. We hope that it will. If it doesn't, everyone can open a TennCare Connect and find out where they are in the renewal process from their TennCare Connect account. But one thing to emphasize is just we want to make sure that people update their address and contact information. That everyone should be doing that.
Okay, so next question, what about long-term care or skilled facilities? Will just one packet be sent for everyone? Will each resident get their own?
Each resident is legally considered to be a household of their own, even though they may be living in a single congregate setting. For TennCare eligibility purposes, each of them is a separate household. In the past, the state has worked with nursing homes to figure out the special procedures to make sure that nursing home residents who in most cases will not be able to help, not be able to complete the process on their own, get help from the staffs. That's been very problematic during the pandemic when nursing facilities have been hard pressed with staff shortages and people being out because of the pandemic to do that. So that's one of the reasons why everything was paused during the pandemic, the recognition of that problem. We expect that there will be special procedures for this group, but they will go through renewal and each will get a packet.
So next question is, will there be any consequence to the client continuing coverage throughout the appeal to then discover that the client is ineligible after all?
No, by federal law, they have the right to continue benefits during that period, and they are considered eligible until there is a final decision that they're ineligible.
It's a great question and good information to know. Can we share this recorded presentation to anyone who might be working with TennCare families?
Yes, and please do.
Yes, that's kind of one of the points that we're trying to make here. There's a lot of ways you can share the emails that we send. You can invite people to reach out to Shana. You can join our on-demand portal, which you'll find a variety of different webinars available there. We will put this one up on that portal as well. All they need to do is to register. It doesn't cost anything to register to be on there, but once you do, it creates an account for you and you can watch a variety of different webinars, including this one. So this one is, could you please do a quick recap of today's objectives, if time permits? Well,
Rob's going to answer this one because I'm too long-winded. Go for it, Rob.
Well, in this one, really what we're trying to do is we've got, first of all, a wide variety or a wide spectrum of people on this call with different knowledge levels, right? So the main goal was we wanted to introduce people to redetermination, give them the basics of how it works, to tell them it's really important to know the timelines and a few best practices around that. Then we had a lot of people that asked, what's the specific plan that TennCare gave to CMS? And we dissected that for you today and explained, how they were going to approach redetermination. So our goal there was to help you maybe answer some of those questions, feel a little more relaxed about what's coming towards you. The other piece is to collaborate, right? So what are the different ways that we can support the work that you're doing? And it really kind of depends on the organization or the individual, what their role is and what they do. So, for example, if you are a financial navigator at a hospital or a clinic or a CAC, you're probably going to want to definitely attend our In the Weeds trainings. You'll probably want to also be available to join the advocate meetings that we're going to have on a routine basis to kind of go over what we're seeing and what people are encountering out in the, really out in the field. But if you're an individual that says, I just want to learn more about this, maybe my organization doesn't help people enroll, but I want to volunteer, let us know, depending on where you're located. I'm sure we can get you plugged in to help out with that. So our goal today was to say, here's what redetermination is, here's what to watch out for, here's what our concerns are, and then here's ways that you can get involved and stay involved in the process, because this is going to be a marathon, not a sprint. And it's going to go on over the course of about a year. Next question is, will families be notified on the portal if they are denied or approved?
We think that information will be on the portal, but they should also receive mailed notices.
And what happens when they are approved? It's going to trigger other timelines. For example, when your next renewal is going to be. As I said, they paused the redetermination process for a number of years. So the month that they might have initially have come up for renewal may not be what the renewal month will be going forward. So it's always kind of good to check the portal, establish a TennCare Connect account, because it will notify you what month you should expect to get a renewal packet.
The next question is, based on the research you've done on this redetermination push, are you concerned that TEDS, which is the TennCare computer system, will require a resource assessment for choices recipients? And again, choices is a program for people who are either receiving home and community-based services for long-term needs, or who are in nursing facilities. And the answer to that is that the state has informed CMS that they will use what is known as the automated resource verification process, which all states are required to have, but TennCare didn't have for many years because of technical problems. They now have that in place. We don't know the scope of it because one of the things, just to digress for a moment, one of the concerns we've had is that we knew that there were problems with TEDS that were identified before the moratorium took place 3 years ago. We know that TennCare has worked to try to correct those in the meantime, but we really won't know how well some of these things are working until they start the machinery back up again. We're hopeful, but we're also concerned. So anyway, we don't know how well or how broadly the resource automated verification system will work. This is a process where TEDS reaches out to financial institutions, find out what bank accounts might be available to people who are in the Choices program. We hope it's going to work well and relieve both providers and families of having to come up with that information, which sometimes can be quite burdensome. But we just don't know how well that's going to work yet.
Next question, is there a plan for public service announcements regarding recertification? Or will entities like CVS, and here I'm assuming it's the pharmacy, CVS pharmacy, have posters at pharmacy counters?
So I go ahead about the PSAs. I can address the pharmacy issue.
Yeah, well, I mean, TennCare has indicated, for example, that they have already done some outreach in November and December. They have indicated that they're purchasing of Google ads. They are also requesting entities like the TJC and maybe the organizations you're with help spread the word about redeterminations and things of that nature. But I think, and Gordon will address the pharmacy issue here, but as Shana mentioned, we do have information available that you can print off, share, post anywhere you'd like it at your physical locations. Give to your constituents where they can reach out even to us and get some help.
Distributed electronically. However, I don't know about CVS specifically, but I am aware that Walgreens has made a push at the national level to inform its local outlets about this. This is coming because this is not unique to Tennessee. This is occurring in all 50 states in the District of Columbia. And you may well have seen publicity because there has been a fair amount of news reporting about the fear that millions of people stand to lose their coverage nationally. So I don't know what the final plan is at Walgreens, but I know that they've given some attention because, again, drugstores are likely to be the places where those and physician practices or clinics where many people are going to learn for the first time that they don't have coverage, and they're going to be very anxious to know what to do.
Can I just say one thing about,
Sure.
sorry. Can I just say one thing about PSAs? Carrie, thanks for that question. I do have some contacts in some rural counties in the state who, and you know how close-knit those communities are, and they have great contacts with their local radio stations, and those folks are avid radio listeners. So they've allowed me to submit some information that they just read on air. They actually don't even charge me for it. So if you know of someone who can help us with that, that would be fantastic. Send them my way.
Thanks, Shana.
Just want to point out, we got a comment which is helpful to remind people that you may be aware that when we've talked about transition to an ACA marketplace insurance plan for people who are losing their TennCare, that would normally be a problem if it doesn't occur during the open enrollment period, which is usually at the end of the year. But there is a so-called special enrollment period that's available to people to transition if they're losing their coverage, which includes loss of Medicaid coverage. So again, that information should be transferred to the marketplace, and people should be informed of their opportunity to apply to the marketplace to pick up new coverage.
So the next question is, does redetermination affect dual eligible persons receiving TennCare benefits?
And dual eligible refers to people who are eligible for both TennCare and Medicare, and the answer to that is yes. Those folks will go through renewals, but it will not affect their Medicare. It will only affect their TennCare coverage.
And here what we're really talking about are the Medicare savings programs.
Primarily, although there are some benefits, long-term services and sports is a good example of that are primarily covered by TennCare. Usually Medicare is the primary payer.
If someone who just recently renewed coverage in January, they go through the redetermination process. I believe you've already answered that.
Right, they should be good for another year.
Will TennCare automatically move folks into TennCare standard or transitional TennCare?
Well, they probably will not do that through the ex parte process because the complexities of TennCare standard. They should do it for transitional TennCare. We don't know whether those folks will have to complete packets or not, but the TennCare is supposed to screen for those coverages. So the question will be, will they have enough information already available to them that they can do that without asking for more information, or will they have to send people a packet?
And another thing to kind of keep in mind, most of these determinations are going to be made using TEDS. And so, if you think about it this way, TennCare standard, transitional, extended Medicaid, those are all categories that are really triggered by redetermination. And we really haven't done much redetermination over the last 3 years. For the most part, it's been pretty much non-existent. So if you kind of think about it in those terms, we're not really sure if there will be a problem in the algorithm, for example, that might erroneously deny people that otherwise might be eligible for TennCare standard. So all that to kind of say, having some knowledge about the eligibility requirements and things of that nature, whether it be TennCare standard, transitional or extended, or the other categories of Medicaid, knowing those eligibility rules is helpful because that will help you identify, yes, this is a time when I know that I should file an appeal, that I should, because I don't believe this decision is correct. Now, if you need assistance with that, because a lot of these categories can be complicated, please feel free to reach out to us. We're more than happy to help you with kind of sort through that. So going on to the next question, what is the best way for hospitals to communicate with TennCare patients? So I kind of alluded to this a little bit earlier. I think any outreach that you can do would be helpful, right? So if you have, patients, or you have clients that are on TennCare, maybe they haven't been to the facility, or you haven't had contact with them recently, I think an outreach program would be helpful because ideally you want them to be on the lookout for it. And a lot of people that end up losing their coverage for not responding might be people that are otherwise in fairly good health. And then all of a sudden an episode occurs, and now they're trying to get a prescription filled or go see a doctor. And it's been quite a while, and they don't even know that they've been cut off, or even know that they're going to go through this process. So I think any outreach that can be done would be helpful. It says this review and renewal process seems to be solely based on financial eligibility for TennCare. Will long-term care facilities be reassess medical eligibility as well? Be reassessing. It's really all of it. And keep in mind that at least for most of the lion's share of the people that are on Medicaid, so we're talking about pregnant women, children, adult caretaker relatives, a lot of these categories really kind of boil down to financial review. But there's a lot of them that also have what we call non-financial requirements. And that's still part of the review process. Now, some of that, depending on the information that they already have, may not necessarily be a problem. It might be also pre-populated. The one thing that I will mention is immigration is also an area where they can make a request, a verification request, for example. However, when it comes to immigration status, that is a one-time determination. It shouldn't be something you have to do every renewal process. And TennCare typically will not ask about that unless they have some information in their possession that would indicate that their status has changed. All right, so typically that should be a one-time deal to make that determination, though it could be longer than that. So this one has to do with seniors and Medicare Advantage plans. Just running the best way to reach out to these individuals, as oftentimes too overwhelming for them to make the contact. And that's a good point. There's going to be a lot of people that are going to struggle with the renewal packet if they get it. First of all, if it gets delivered to them, they could have moved and maybe not notified them, or the packet may not have even gotten in the first place. There are other people that might get a packet and get confused. They could easily be on Medicare or something. Oh, well, TennCare doesn't apply to me. I just think for any of these individuals, the best way to reach out to them is to say that, hey, there might be, you might get a packet, and if you do get a packet in the mail, there's people that can help. And for example, the Tennessee Justice Center can help, but I'm going to encourage them to seek help with it, not to just set it off in the corner and decide that they'll get around to it later. I think any outreach you can do to people will be helpful, because you never know. There might be somebody that has a Medicare Advantage plan, but they're also the caregiver for a child, maybe a grandchild, for example, that they might get a packet. So I think anything we can put out there and notify people of potential opportunities for getting help and what might come their way will be helpful. Next question is, what else can hospitals do to prepare? Is there a sample letter that we can share with them upon scheduling registration to have them prepared to potentially receive? Once again, I'm not aware of anything that TennCare has put out there on that. This is, again, a call to collaborate. More than willing to help you think about that. I think on a lot of situations, who will be receiving this, this letter? We'll be going to parents, we'll be going to seniors, and about people if language, English proficiency is a problem. So those are things that we can help you come up with a strategy for, and even help you draft a letter if that's something that you're interested in. In that particular instance, please reach out to Shayna, and we can see about getting with you and see how we might be able to help. I hear, quote, TennCare is required to, or TennCare is required to do X, but many of us know they don't always do the things they're required to do. That is correct. Do we have any hope that they will follow the rules better this time around? Well, we certainly hope so. I mean, the problem with the first redetermination was, TEDS had just kind of rolled out. They were kind of getting used to using it. The system was brand new at the time, and so it's going to be obviously ripe for errors and things that would happen along those lines. They also got rid of a lot of staff that previously were there to help. And I think hopefully that this time around we'll have less of those particular problems. But with that said, I think we always need to be aware of the potential problems that are there. They've had quite a bit of time to address these issues in the algorithm that would cause really kind of massive terminations or disenrollments from the program. So don't really know, but that's why we need people that are, for example, on this call as being eyes and ears to share with others and us the things that they're seeing. And if something doesn't look right to you, then it probably isn't. And those are things that we'd like to be aware of. Next one, whether 2023 income guidelines for TennCare. That's a great question. I'm not quite sure that they're put out yet. Typically, it's about this time of year that those guidelines are updated. As a quick recap, the federal government puts out the federal poverty guidelines and limits, and those typically are going to affect about every category of Medicaid and CHIP. The only thing it really probably doesn't do is it's caretaker relative, though, as Gordon mentioned, they're working on doing that. The problem is it comes out about the first of the year. Once it's published in the Federal Register, then agencies, for example, the states, are free to use those updated guidelines, okay? But it's up to the individual agency to make that determination. So usually about March, about this time, TennCare will start using those, and then they will use, for example, 2023 into 2024, January and February. So it overlaps years just a little bit, but anytime that should be made available. And I believe they do update their website. We do produce tools on our website that are available that will help share when that income is going to be made available. But really about any time is when they're going to start switching over to the 2023 federal poverty limits. So this question is, can you give us more information about qualifying medical conditions that you mentioned before? Is there a list? This is only for TennCare standard and only for children. That's going to be there. There is a list, I believe, is available in the policy manual, but that's something that we can share. So I'll make a note on that to share the links for that. But it's a difficult, as you can imagine, threshold to achieve, but it is something that is there and will require medical review. So typically when that is being done, it needs to be supported with not only physician notes or opinions, but also data to back up those opinions and the basis for that diagnosis or treatment. Those types of things are going to be needed along with it. Does the redetermination process then roll over after months 1 through 12 and become a continuous process once a year for everyone except SSI recipients? The answer to that is yes. So once they kind of get through this, what's going to happen is then based on when they go through this redetermination process, we'll probably trigger the next one. Once again, it depends on whether or not their benefits can be renewed versus ex parte review. But if it can be done through ex parte, chances are they're not going to see that. But otherwise, yes, it will renew. SSI recipients, that will be really the exception to that. And it's just a comment that's put out comparing it to Illinois' Medicaid program, that they had a significant negative impact because so many addresses were inaccurate, or maybe social security numbers or educational blocks. Knowing the state has a goal to reduce enrollees by 500,000 is very concerning, and you are absolutely correct. It is for a lot of reasons. Just be careful comparing the state's Medicaid programs. Medicaid's been around a long time. There's been a lot of different, what we call 1115 waivers that gave states leeway to make changes to their programs in an effort, quote, to improve them, including Tennessee. So as you can imagine, over time, a lot of things have changed. Some states even offer greater benefits, for example, California, than say, for example, Tennessee. So we have a saying, if you've seen one Medicaid program, you've seen one Medicaid program. So please keep that in mind. However, your assessment is very much spot on. There's a lot of reasons to be concerned in the fact that TennCare really wants to get this back down to pre-pandemic levels, indicates that a large number of people are going to have to lose their coverage for that to happen. Can always be proactive in completing the recertification process before receiving the notice from TennCare that they need to recertify. Well, the best thing that you can do, quite frankly, is to make sure you establish a TennCare Connect account and be on the lookout for the things that are going to be coming your way. Now, you can get a little bit ahead of that when you initially apply, but for the people that are already on, I don't know if there's a whole lot that you can do. One thing that you can do to prepare, which is probably even more important, is if you're dealing with a category that would require a resource verification, a lot of times collecting that information ahead of time will be helpful. Fair market value, for example, that how is it titled, the ownership, getting those documents put together might be helpful, and that sometimes takes a little bit of time to do, but that is something really that you can do. Other than that, just establish a TennCare Connect account and be on the lookout, monitor it regularly, and look for ways, and really be on the lookout for, hey, a packet's coming, or here's a re-verification request that's coming. So there are questions about asylees and people with immigration, the status being a question. I kind of mentioned that before. We typically go through that one time. That can be very complicated. There are rules. For example, there's a 5-year bar that prevents people from accessing Medicaid unless they fit into an exception to the 5-year bar. And if they do fit into one of those exceptions and are able to apply for Medicaid as if they're a U.S. citizen, there is a 7-year time limit for them to really to go and convert that status to LPR. That's something that they need to do. That can be pretty complicated in understanding how to do that. So if you run into these type of situations, please feel free to reach out to us for help. We can help navigate that process with you. It really kind of depends on the individual, the documents that they have, how long they've been in the U.S. and things of that nature. Also, question about MSPs. Yes, they are going to be reviewing those as well. We talked about that previously. Next question asks about children prior to the pandemic who are in the process of moving into an adult category. Is there a likelihood that ex parte will reveal the patient has no income, or will the child becoming an adult need to start the process over? Once again, it's a good question. If they have coverage, they will go through the redetermination process that should be pre-populated with information that TennCare has. From that information, that's how you will kind of address that. I'm not sure if they're going to be able to do that through ex parte. I'm just not quite sure on how they're going to be able to do that. I would assume that they won't. But then again, it's just something to kind of be on the lookout for. So as well, the MCO care coordinators be involved with nursing notifications at upcoming renewals, or the facility app to get the information from the website. Again, I'm not quite sure. I know that in the plan that they submitted to CMS, that they are going to be reaching out and having some of the MCOs help out, especially with the address notifications and making sure that people have the correct address, really that's in there. So that's going to be kind of important to know that that's something you can do. Also, if you're a provider, you can check the status of the renewal using I believe it's Tennessee Anytime. I apologize if they've renamed that, but there's a way that you can, when you're looking at coverage, identify kind of where they're at in the process. So this is another one. Our state and most programs continue to use household income. Since COVID, we are seeing more family moving in together. Total income in the household puts everyone outside the qualifying income guidelines. Any ideas as to how the government programs may eventually address this dilemma? Well, that's a complicated one. All I can tell you is you're best to attend one of our Medicaid eligibility boot camps. And here's the reason why. There are a lot of categories in excess of 20 where you can find coverage or a pathway to coverage. The problem is all those categories are going to probably use one of 3 different methodologies for counting households and income. Depending on the category dictates the methodology that's used. That methodology is going to have specific rules around who is considered in the household. The danger here is you do not want to lump everybody together in a household and consider and think that that's the Medicaid household, because chances are that is not. Another thing that I want to add is that Medicaid eligibility is an individual determination, not a family determination. So in theory, it's very easily, especially in a blended family or multi-generational family, to have every member of that family, even though they're living together, have a different household for Medicaid household counting purposes. And who is in the household determines whose income counts. So keep that in mind. This is very, very category specific. And so you need to know the rules around that. The rules around counting households and income are more complicated for the MAGI categories that are caretaker relatives, pregnant women, and children. TennCare standard. Those counting households can be a little more complicated, though we do have a lot of resources that can help with that. Once again, if you have complicated situations, you need some assistance, please reach out to us. We'll do our best to help. Can someone set up a TennCare Connect portal at this time? I believe you can. Unless the system is down, you shouldn't have a problem establishing one on TennCare Connect. That could go for people that already have coverage, as well as people that are just wanting to start the application process. It's going to give you the opportunity to do that either way. So patients under pregnancy care with TennCare, if they fail to fill out and submit the paperwork within the 40 days, what is the plan? We cannot discontinue or abandon care. Well, once again, the best thing to do is get ahead of that. If they don't return the paperwork within 40 days, they're going to get a notice in 20 days indicating that they're going to lose their coverage, right? They'll be terminated from the program. And then after that, if that happens, and they don't get the packet back in, they're still going to have another 90 days. The best thing that you can do is stay on top of that and help them with it. This is where outreach will become very important. Don't assume TennCare is going to continue to pick up the bill if they don't go through with the renewal process. If you indicate mail as your preferred method of contact, will documents also be available on TennCare Connect? This should be. Almost everything that is generated out of TennCare Connect regarding eligibility, not necessarily explanation of benefits that would necessarily come from MCO, but those things that deal with eligibility, those should be made available on TennCare Connect, even if you indicated that you want to receive those via the mail. So once again, best practice is to go establish that account so you can go check for verifications and see if they're there and respond to them in a timely manner. This is a good point. Someone reached out and said that federally qualified health clinics should have enrollment staff to assist consumers complete those packets. There's also other hospital systems that help with that. I know, for example, Murray Regional Medical Center down in Columbia has people that a lot of times will help out with that as well. So yes, if you're a CAC and probably at a federally qualified health clinic, those are ways that you can also probably get help with that. Keep in mind that this process can have the potential of overwhelming people, especially when we get about 6-8 months into it. And we're, the TJC is a place where we can also help with, really with some overflow if that's something that you need. So one says, so we need to reach out if we would like to set up a renewal clinic or discuss the option anyway. That is correct. My suggestion is reaching out to Shana. We can talk about, what it kind of looks like, how many people would need assistance, are there other volunteers in the area? So there's a lot that kind of goes into that. But Shana, I'll let you add anything to that if you'd like.
Yeah, we've had a lot of success. Most recently going to a school here in Davidson County where we made a couple of trips, and the guidance counselor there arranged for folks to kind of sign up for a slot of time that they could spend with a client advocate. So that gave us an idea of how many client advocates we were going to need. But a lot of the questions were just folks who just needed clarification on the renewal process and what to expect. So it's a really, really good just kind of opportunity for us to educate people face to face as well. But it kind of seems like every clinic is going to be kind of a different situation. So it just takes some planning. And like Rob said, just an idea of how we need to staff it up and how many volunteers we might need. And how many are available in the area. So if you're interested in doing that, well, I've got a little bit of experience with that now, and we can set that up. I'd really love to. And keep in mind too that we can use our language services. So if we don't have translators available in your area or to bring along with us, we still have a backup plan for that.
It's a very good point. So again, this is a way that you can reach out to Shana directly. Also, we have the forms. The form will be, it was in the email that went out yesterday. It's also be embedded in the slide deck. One thing I will mention that we've run into problems in the past, probably more on the provider side, that the spam filters tend to be fairly robust and will block a lot of things that we try to send out. So if you don't receive, for example, you didn't receive the email yesterday, or you don't receive a copy of the slide deck by noon on Friday, that's something you want to reach out to us so we can make sure we get it to you. I know that's been a problem on some of the trains that we've kind of done in the past. We will take just a couple of more here, but really appreciate everybody that's still hanging in there with us. I think one thing that pops up, it says, how do households who do not have access to computers or online access complete the process and get notification of eligible services? Well, that's a little bit of a twofold question here. They should receive information in the mail, all right? So that's why it's really important that TennCare Connect and TennCare actually has your most updated contact information. If you're an advocate and you're someone that can help out and help monitor their TennCare Connect account, that is even better. That's probably even the best practice if you can help with that, because then you'll see if there's any verification requests that are made that they'll actually receive. So you know, mail a lot of times is delayed, and it's not uncommon for some people to get, you know, a request for more information, a verification request, and only have a day or two to respond, and that can be problematic. So the best bet is to try to help with that the best that you can. We also know from our own clientele base that someone might have, you know, smartphone, that's their only way that they can communicate, but maybe they have limited minutes, or maybe they don't have as much data towards the end of the month. And so then their access to getting onto the portal can vary. So this is other ways we're advocates, whatever you can do to kind of help out with that will definitely help your clients immensely. And that's probably about the best I can suggest with that. Most definitely make sure that their contact information is most up to date with address so they can't get those mailings. One question, is there any data around TennCare Connect not having current info or not returning info about client coverage? I don't know for sure if we've seen anything about that. My guess is it probably held a little bit closer to the vest, though it might be made available later on. I mean, for the most part, not much of this has been done over the past 3 years because of the pandemic. So I think any data that existed beforehand, you know, from the first time around is really not fair, probably to TennCare to say that that same problem holds true today, because we're just not really not quite sure. One question is, will the dates for renewals be listed on TN anytime like they were years ago? I'm not quite sure. I mean, when we reviewed the CMS or the report, the plan that TennCare gave to CMS, they indicated they would be able to check check the status of those renewals, but they didn't identify the name exactly of the portal that's being used. So I'm not quite sure of that one, though that's supposed to be made available. If you have the opportunity or have a TennCare representative that you interact with, that'd be a great question to submit to them, and once again to share back with us. That would be helpful. This will be the last question that we'll do. Once again, if there's other ones here, please feel free to send them to Shana or myself. But it said, should we continue to provide TennCare applications to patients without coverage? The answer is yes. So here's the thing. You encounter somebody without coverage, all right? That could be for a lot of different reasons, right? And it might be that they don't know. It could be that maybe they've applied and they were denied. And you have about 40 days to appeal a denial. Maybe they're within that 40-day window. A lot of times we'll tell people to go ahead and reapply for coverage while we file an appeal. And at that point, if they get, for example, let's say they get their coverage before the appeal is fixed. Now they have coverage going forward. But then let's say we win that on appeal, we can always kind of fix, the effective date issue if that pops up that way. If they are losing their coverage because of redetermination and they're still within that 90-day window period, I would suggest at that point, as we mentioned earlier, the preferred method there is to really complete the packet and get it sent back in. And you can request another copy of the packet if you didn't receive it the first time. The reason for that is it will backdate in coverage to eliminate any of those gaps that are there. Also help with any pre-certifications that go along with that. So that just makes things a little neater on that end, and hopefully would eliminate some of the delays and potential red tape. And then the other thing to kind of keep in mind is not every category has retroactive coverage for people that are found eligible. For pregnant women and children, once they're found eligible, like most states in the country, there's a 90-day retroactive coverage period. And it looks back 90 days, and that's when the effective date would kick in, provided they were still categorically financially eligible at that time. So in most cases, that's the situation, but it does look back. Tennessee's had a waiver of that for about 27 years. just recently with TennCare 3, that approval. They expanded that only to pregnant women and to children. At the TJC, we firmly believe that any person eligible for Medicaid should be eligible for that 90-day look-back period. So that is something obviously that we're working hard to defeat. That's really about the only thing that's left of the TennCare 3 waiver that the state hasn't already walked back. So we're working hard to try to get rid of that, because once again, that should really apply to everyone. So that situation can be complicated, but there are ways to kind of do both. I think the only thing that I would watch for is, I think the preferred method would be to try to do the renewal if you can, because that will eliminate any gap in coverage where otherwise they may not have that luxury if they were to submit just a flat out new application. So folks, thank you very much for attending today's webinar. We will make it available on demand. Again, I apologize for the technical difficulties we encountered at the beginning of the program, but I hope that you found this information insightful. There's a lot of ways that you can stay connected. There's meetings that you can join that we will have on a regular basis to go over what we're seeing, in the field, to have people share their experiences. And so I really encourage you to complete the partnership collaboration form that we made available, and it is also available in the slide deck. And we will be reaching out to you and seeing how we can partner with you in the future. So thanks everybody, and have a great day.